Well, hello, future nurses. Welcome to Med Monday. I'm Cynthia. I am the lead instructor and the creator for Nursing School Simplified. Before we get started, I just want to remind you that if you haven't already subscribed to the weekly email for Med Monday, go ahead and do so when we're done here. You're missing so much vital information that I don't provide here on the slides, but I do in the emails. So each week you'll get the video sent to you, and you'll get the weekly med fun sheet that you can use as a study tool, and you can use it to make your med cards for clinical. So go to nursingschoolsimplified.com/Med Monday, and I'll send that to you every week. So let's go ahead and get started with this week's Med Monday. We're going to be talking about a very common medication that's given to just about all patients that are in the hospital. So we need to know about this. And our weekly Med Monday is heparin. So heparin is an anticoagulant and an antithrombic. It can be given IV and subcutaneously. It's given to prevent conversion of fibrinogen to fibrin and prothrombin to thrombin by enhancing the inhibitory effect of antithrombin 3. This is important to remember. Its half-life is 1 to 2 hours. It's excreted in the urine, and it's metabolized by the kidneys and the liver. So the indication for this, or why are we giving this medication? That includes to prevent DVTs, meaning we're giving it prophylactically to prevent DVTs. And that's part of core measures. Every hospital has to observe this because hospitalized patients are at increased risk for developing DVTs. We give it to patients who've been admitted for MI, PE, and open heart surgery, for reversal of DIC, for patients in atrial fibrillation, and to maintain patency of indwelling catheter devices. So contraindications, or why we're not giving this medication, include hypersensitivity. So if they have some type of allergic response to it, bleeding for sure. And we want to use this cautiously in alcoholic patients, so ETOH, patients with liver and renal disease, patients with bleeding disorders, severe hypertension, and bacterial endocarditis. So side effects. What are our side effects? These are minor, non-life-threatening. Oops. Let's go back. There we go. Side effects. Rash, dermatitis, hematoma, cutaneous necrosis at the injection site. So for our sub-Q administration, you want to make sure that you are rotating that site, documenting where you're injecting it, and you want to make sure that you observe the site for any adverse reactions. We're also going to watch for bleeding. That is a side effect, and as well as bruising. Our adverse reactions or life-threatening reactions include hematuria, which is bleeding in the urine, hemorrhage. So if our patients, God forbid, fall in the hospital, we want to, and especially if they hit their head, we want to make sure that we monitor for that. So they will be getting a ride to probably CT to check that out. Thrombocytopenia, heparin-induced thrombocytopenia, and anaphylaxis. So that's full-blown allergic reaction. So nursing considerations, what do we need to think about and monitor while we're giving this medication? Well, we want to monitor for therapeutic effect. We want to make sure that our patient isn't having a DVT or doesn't develop a DVT, that they aren't having any bleeding side effects from it. We want to monitor our labs, and that's the next one here. We want to make sure that we're monitoring our CBC, which is a complete blood count. And specifically, we're going to be looking at the hemoglobin and hematocrit, and we're also going to be looking at the platelets. We also want to look at our our coagulation studies, which is our PT and our PT-INR. But specific to heparin is our PTT. And the way you can remember that is that T, those two T's there, they kind of look like a little H. So PTT is for heparin. And then we want to look at our chemistry panel because we want to monitor our kidney function, specifically the creatinine. And I should have included here our liver function. We're going to check our liver function before that because we want to make sure that our patient isn't at risk for bleeding because of liver dysfunction. We do want to assess our patients for bleeding. So, where are we going to be assessing? We're going to be looking at their gums when they're brushing their teeth or when we're doing oral care. We want to check their urine, check their stool, and we want to make sure that they aren't. That they don't have any bruising or hematomas developing, because even a slight bump, if they bump their arm, let's say on the side rail or on the door frame, or God, who knows what they can bump on, but especially in our older patients, they are at risk for bleeding and for developing hematomas. And so we want to monitor for that. And you need to know this, the reversal is protamine sulfate. And do not confuse this with low molecular weight heparin, which is Lovenox. And its decreased effect with cardiac glycosides, digoxin, tetracycline, and nitroglycerin. So, what are we going to teach our patients? Well, we're going to teach them signs and symptoms of bleeding and what to look out for. So, we want to make sure that they monitor their gums while they're brushing their teeth, that they look at their urine and their stool and report any abnormal bleeding to you, the nurse, or to the physician. We want them to use a soft bristled toothbrush. We're going to notify our physician if the patient is pregnant. And so if our female patients have not reached menopause yet, we do want to do a pregnancy screen on them to make sure before we really start giving a lot of these medications, because they are contraindicated. We want to make sure that they're using an electric razor because we don't want them to nick their skin, because those can bleed for a long time before they start to clot off. And it can be held during menstruation. And we also want to check with our patients if they're taking any herbal supplements or over-the-counter medications, because these can affect the efficacy of heparin or how it works. So, our weekly challenge question. The nurse practitioner orders a heparin infusion for a 250-pound patient admitted for PE. The pharmacy sends heparin in a 25,000 unit 500 ml NS bag, and the nomogram indicates a bolus of 80 units per kilo with the maximum initial dose of 8,800 units to be given, and then start the infusion at 18 units per kilo per hour with a maximum initial dose of 2,000 units per hour. We're going to run that for 6 hours and then recheck our PTT. Now, this is a two-part question. How many units are you going to program the pump to bolus? And how many units per hour will infuse over 6 hours? Oops, we're going backwards. So, make sure you enter your answer in the comments to be entered to win a $25 Amazon gift card. And that's it. That's all you need to know for that medication. I'm so glad you were here today. Thank you so much for joining me. I hope you enjoyed it. Have a great week and keep working on your dreams.